you can imagine that I restrict certain nutrients from your diet, such as, take for example, vitamin B3, which is linked very closely with depression in the brain. And what depression is, in essence, on a biochemical level, is your body's sort of inability to produce enough serotonin, which is the feel-good hormone. Now, as we talk about in the documentary film, there are certain types of drugs that are targeted for depression, and the most popular drugs you see on the marketplace are the SSRI antidepressants, and these are serotonin reuptake inhibitors. And what they do is they stop the reabsorption of the serotonin back into the brain, so that any serotonin that is produced will stay around longer in the brain. But the side effects of these medications are very, very, very damaging. And one of the most dangerous side effects of these medications is suicidal thoughts and tendencies. And this is one of the side effects that my father was suffering from. And I would like to talk about a story about a particular medication as well, which knowingly denied these side effects for many years in a moment.
Prozac R?
That is correct, from the documentary. So you've got this condition where the brain is unable to function correctly, because the brain, like every part of the body, needs nutrients. We need nutrients from our food, and if we're not getting enough nutrients, we're going to develop deficiencies. And then as you develop deficiencies, you're going to develop illness. And the illness of the brain is depression, and it's many other illnesses as well. Alzheimer's, memory loss, these sorts of things are also related to lacks of nutrition, especially a lack of omega-3, which is the essential fatty acid. So you take a brain that is deficient in omega-3, you take a brain and a person that is deficient in vitamin B3, and you will have a tendency towards depression-like symptoms. You then go to a doctor who prescribes you a medication, and all that medication does is stop the reuptake of the serotonin in your brain, causing you momentary feelings of elatedness. But what it doesn't do is it doesn't correct the nutrient deficiencies. And when you consider the fact that 2 handfuls of cashews provides the therapeutic equivalent of a dose of Prozac, you start to see the problem that we have here, because cashews provide tryptophan. They contain tryptophan, and tryptophan is the precursor for serotonin in our brain. And then you look at the drug-based approach. So a nutrition-based approach for depression would be cashews, vitamin B3, which is niacin, omega-3, detoxification, more raw foods, this sort of approach at addressing the nutrient issues. And then you take a drug-based approach, which is based on saving the small amount of serotonin that's left in the brain with all the associated side effects. And so one of the dangers of this case, the Prozac case, which I wish to talk about now, is that Prozac was coming off patent in the mid-2000s, about 03 to 05, somewhere there. And they were bringing out a new version of the drug. And every time a drug company needs to create a new version of a drug, they need to state what improvements that drug has on the existing drug. So there was some tinkering with the molecular structure. They created a new drug called Prozac R. And when they released the patent application for Prozac R, the benefits that they said this drug had over the existing drug was that it would not cause the suicidal side effects that the previous drug had. And this was at a time when the drug industry was denying the fact that their previous drugs were causing suicidal thoughts. So
James Colquhoun,
very little trust.
I want to come back to that example. We need to take a short break here. James Colquhoun, documentary film producer of Food Matters. I recommend it highly. Now we hear a song from the only singer tonight who was a comfort food himself, Meatloaf, here on Coast to Coast AM. My guest is documentary film producer James Colquhoun. James, I'm sorry to have cut off our conversation about Prozac. Just to recap, though, Prozac, whenever questions are raised that, hey, maybe it's making people more suicidal, the manufacturer says, no, that's a bunch of baloney, until they had to put out a new and improved Prozac to keep their patent going, and then they basically admitted that, in fact, that the old Prozac was doing that, but the new and improved Prozac wouldn't.
Indeed, George. It's a very, very, very dispiriting thing to learn about, especially when, in my father's instance, and for many other millions of people around the world right now, they're being sold these alternatives, they're being sold these medications as the promise, and really we need to be re-questioning, how we're dealing with depression, mental illness, and many of the other illnesses that we're talking about on the show.
Let's talk about the role of the medical industry in this a bit. I was very surprised to see in Food Matters this statistic that basically very few doctors, American doctors anyway, get any kind of training whatsoever in nutrition.
It's a very scary statistic. I mean, what we brought up in the documentary was that less than 6% of graduating physicians in North America receive any training in nutrition. And this is very, very, very severe. I mean, what's so interesting about this, George, is that we have Hippocrates, the father of modern medicine. Everybody has heard of Hippocrates. And Hippocrates' mantra was, "Let thy food be thy medicine, and thy medicine be thy food." And the Hippocratic Oath is still, to this day, it's still said by medical doctors who are indoctrinated into their profession. And when this mantra is read out, and also one key aspect of Hippocrates' work was first do no harm as well. So first do no harm and let thy food be thy medicine. I mean, this is the founding father of modern medicine, and yet now we have this scenario where less than 6% of graduating physicians in North America receive any training in nutrition. So what we're seeing is that drugs are being used as a first port of call, and as opposed to nutrition and natural approaches and more gentle, less harmful approaches, which are much more effective at treating the underlying causes in many, many cases.
And the consequences,
have a real problem here.
The consequences, as detailed in your film, are dramatic and disturbing. As you document, there are, because people get unhealthy, they're eating the wrong stuff, which is very basic. They eat the wrong stuff. They get unhealthy. You have 39,000 Americans die from unnecessary surgeries every year. You have 80,000 die from infections that they get when they're in the hospital. And then 106,000 or so who die of drug reactions, not overdoses, but drug reactions. Many of these cases would not have had to happen if people paid attention to what they were eating.
Absolutely. And I think I'd like to touch on this figure here of the 106,000 people. So we have 106,000 people in North America dying from adverse reactions to pharmaceutical medications each year. Now, what is so alarming about this statistic, George, is that these deaths, these 106,000 people per year, are from medications that are properly prescribed. These are normally expected side effects, and they're used as prescribed. This does not include overdoses. So this is people taking the right drug in the right dose, and yet we still have 106,000 people dying in America each year. In the United Kingdom and Australia, we have very similar statistics. But what's so fascinating about this, George, is that we have so many people dying from adverse reactions to pharmaceutical medications, and yet nobody hears about it. And this is what we were so driven to use Food Matters and the film to help get this message to more people, because it needs to be heard. In the United Kingdom, you've got 10,000 people a year dying from adverse reactions to drugs, and at the same time, only 3,500 people dying from car incidents and 9,000 people dying from prostate cancer. And the amount of publicity in the United Kingdom around making the roads safer and car incidents and death tolls and prostate cancer fundraising drives, and yet nobody hears of the fact that 10,000 people are dying each year in the United Kingdom. So we have similar scenarios in Australia, the United Kingdom, and America, and it's absolutely shocking, and it's not called for. It's not necessary.
More shocking is the point that you drive home in the film, and that is the comparison of pharmaceutical solutions, and I use that in quotation marks, to vitamins. Because as we've learned on this program tonight and in popular news articles in recent weeks, there is a move afoot in this country to ban the sale of vitamin supplements, to control them, to regulate them because of the danger, supposed danger, with taking overdoses of vitamins compared to the very demonstrable dangers of taking pharmaceutical drugs.
This is a very scary situation. Now, the regulatory industries that protect these bodies, they protect the agrochemical industry, they protect the agribusiness giants, they protect the pharmaceutical industry. These regulatory bodies are very heavily controlled by the industries themselves, as I'm sure your listeners and yourself are very aware. But what we have as a new level of control in the health and nutrition field is we have this control, this new code, this codex alimentarius, which is a control over how the supplement industry is regulated. And the more control that the regulatory industries can have over the supplement industry by limiting supply, reducing available doses to people, is basically going to play into the hands of the pharmaceutical industry. So, we're seeing these regulations tighten up, and we as consumers need to take control and take control over our health, over our purchasing decisions, over the food and the supplements we can consume.
Back to discussing the medical industry itself. You already mentioned that doctors, very few doctors get any kind of nutritional training in medical school at all. It gets worse because there are those medical professionals who are interested in nutrition, the benefits of nutrients and vitamins. They've written scientific papers, peer-reviewed papers that have been published in professional journals. Those journals just basically get tucked into a drawer and ignored, which is, I was amazed to learn in your film.
Well, we have this situation where the drug companies are in such a position of power, and it's really a regulatory problem that we're talking about here, George, because it's the way that the pharmaceutical industry is regulated that is the problem. We have the bodies that are required to license and regulate drugs, and also the bodies that are around to educate the doctor industry are controlled by the pharmaceutical industry. So, for instance, a doctor in his practice, and this is where I sympathize with many of the doctors out there who are trying to do their best, but their only source of information that is available to them, generally speaking, is coming from the pharmaceutical industry. So the pharmaceutical industry controls the medical journals because they are the primary source of funding for the medical journals. They advertise in these journals and hence have created an element of control over these journals. And so any studies that they publish about their medications that are favorable for the medication, they get published in the medical journal, and they also buy back copies off the journal producers and advertise in the journal. So the information being fed to doctors is coming from medical journals, which are funded by the drug industry. It's coming from drug reps, which are paid representatives from the drug industry, and it's coming from postgraduate training. And all doctors have to undergo a certain amount of training each year to keep their license. And 65% of postgraduate training is funded by the drug companies through conferences as well. So we have a situation where a doctor might be so busy that they have very little time but to see as many patients in a day as possible, that any source of information that they're being given is from the pharmaceutical company in most instances. And that's where we have a situation where there's so many prescriptions being out and so many people consuming this drug.
Well, I think it's probably worse than that, in that many physicians are on the payroll, that they accept stipends, regular payments from drug companies in order to agree to dispense only those drugs.
And the more that they dispense, and if they're the best dispensing doctor in their area, they're invited to conferences and in international golf trips and holidays. And